Hi Team Run, Physio Megan here. Today I'm going to talk a little bit about running after a hip or a knee joint replacement. And this is something that is emerging a little bit more in the literature now. And that's because a lot more younger people are starting to have joint replacement surgery. Now, if you are very active, if you're a runner, you've always been a runner, and you find out you need a knee replacement or a hip replacement because you're in pain, the thought of probably not running again is, unimaginable, very daunting. And we are challenging the status quo a little bit now. And we're finding that actually there are more studies to support people returning to running after knee and hip joint replacements. If you fall into this category, if this is something that you are thinking about having, but you're really worried about it impacting your running, then this is something you really need to discuss in detail with your surgeon and a healthcare professional, ideally a physio, who is going to be supporting you through that rehab process. So there's been a few studies out now that have shown that lots of people are returning to running following these joint replacements. Some of the studies are in higher end athletes. There is some studies in ultra runners where people have been shown to go back to quite excessive amounts of volume in their running post surgery and quite quickly. But for the more recreational athlete, it's probably more likely going to be sort of a 6 to 12 month plus rehab program to get you back into running. Now, often people have concerns about the stress that it's going to put on the joint replacement, and there are risks with loading through joint replacements. It might, we don't want anything to loosen or become unstable, and if getting back to running is important for you and you're working with your surgeon and you're working with your physio, they may recommend that you have a little bit more imaging throughout that rehabilitation process just to check the joint replacement. So this might be every 6 to 12 months. But it is, if it's valuable to you, if getting back to running is really important to you, discuss it with your consultant, because it isn't impossible. It can happen. It's just, you've got to take lots of other things into consideration. So there's that time frame. It's probably not going to be a quick fix getting a hip or a knee replacement, I think especially a knee, and getting back into running super quickly. It's going to be a long process in terms of that rehabilitation, and you have to have some considerations around the precautions and contraindications and the things that might go wrong, and how you and your consultant and your physio are going to monitor that going forward. Obviously, we need to do all the regular things that we would do post joint replacement anyway. We need to be making sure that you've got full range of motion of that joint, that your strength is up to scratch, that you have really good control. And that's even before we probably start introducing a running program. So then we've got that on top of it. So you can see that process could be quite long. But there has been studies to show that running after a joint replacement doesn't actually increase the chance of you having a revision, so having another replacement later on. And lots of people can go on to do running without any other previous complications. So there are options there, and it isn't just a hard no on if you have a joint replacement, you can never run again. In the research, they found that people with lower BMIs have a higher success rate of returning to running. So if you do have a high BMI, then weight management might come a little bit more into that strategy with regards to the rehab. But again, it's a very multifactorial approach, as most things are. From a rehab perspective. But I think it's just really highlighting that we're not having this blanket no anymore, that we're asking more questions, more people are doing research on it. And I think if your if you're in a position where you have been told you might need a joint replacement, but you want to be able to continue running, it is something that you can have a conversation with your consultant and your physio about, and you can put the steps in place to get you there. It's just considering all those other little elements and creating a plan over time. If you have any questions regarding running and joint replacements, then please feel free to pop a comment below and I will do my best to answer that. Other than that, guys, happy running.